Okay, so I am going to transport my patient that is on the vent, and I'm going to teach you how to do that. So first thing first, I'm going to verify the physician's orders. I see that I've been ordered to move Mr. Jones to a CT scan. I need to gather my equipment. So I have my stethoscope, I have my pulse ox in my pocket, I have my 10mm syringe, I have my oxygen tank, BVM mask, I have a mask as well. I have my transport ventilator. I have the PEEP on the end of the BVM mask, I believe. Oh, and I have my cardiac monitor. I have my ECG lead attached to the patient, and I have everything that I need. So before I do anything, I'm going to check that I'm at the right room. I'm going to wash my hands, put on my gloves. I now enter the room. I explained to the patient why we're doing this today. The doctor had ordered a CT scan. We need to take the patient down to CT to get them scanned to see what's going on. As long as everything is good, it's relatively easy to do. There are a few risks of doing this. We could accidentally extubate the patient, not be able to properly oxygenate the patient, have unstable hemodynamics. Yeah, I believe those are some things. And if we can't oxygenate the patient can become hypoxic. So we are now ready to set up the vent. So prior, I've done my tank. I have done the tank duration calculation. I've cracked the tank by using this little guy and cracking it on. The tank has a PSI of 50, and it'll last me about an hour and 45 minutes, which should be plenty of time to get to CT. So I'm going to go ahead and start putting things together. So I have my tank. I'm going to take it out. I'm going to attach it to the ventilator and then place it on the bed. This is a labor and delivery bed, so there's not a spot for like we're gonna leave it off for the sake of the video. Okay, so we're just gonna pretend that my O2 holder is right here. I'm just gonna nicely lay it down. I'm actually gonna put it right here so it doesn't fall on the patient's leg. So we got that ready to go. And then we're gonna go ahead and input our settings for transport. So we are going to do, let's see, where am I at? We're gonna do AMPV. We're gonna do our rate at 12 breaths per minute. We're gonna do our tidal volume. We're gonna do it at 500. We have our eye ratio at 1. We have a PEEP of 5. We have our flow trigger. We're gonna turn that down a little bit. We're gonna put that at 3. We are all ready to rumble. Hello. Okay. So everything is ready here, but before we do that, I'm going to make sure that this is connected to my oxygen tank. And we're going to screw it in right here just in case we need it. We're going to carry a mask with us in case the patient becomes extubated so we can attach it and do all the things. I'm going to demonstrate how we would use this if that does happen. So if you were to lose it, we would just pop this off, attach it here. We provide ventilation that way. And in the event that we lose the entire thing, we're gonna use our mask and put it over the patient, which is why we need the mask to begin with. So now that we have our transport vent ready, we can go ahead and connect the patient. Before that, I'm going to assess my patient. I'm going to put my pulse ox on the patient's hand. I'm going to make sure that it stays on the entire time. Have my leads on the patient. They are attached to the cardiac monitor. I'm going to listen to breath sounds. I did it 6 times. Everything sounds good. My vent settings are great. So I believe we are now ready to transport. So I'm going to remove my test lung. And we are ready. So now we remove this. We're going to attach it to the transport vent. We're going to put that right there. This popped out. Okay, so we have everything connected. Patient's attached to the transport vent. ET tube is secure. Pulse ox is on the finger. So we are now going to listen to breath sounds before it is time to head down to CT. So I'm just going to double check that. We listen in 6 spots. Everything sounds good. Everything is set up, and we are now ready to transport to CT because the transport team is here. Okay, so we go do that. We're back. We're back from CT. Everything went well. And we are going to go ahead and connect the patient back to their original ventilator. So we are going to pull this out to put the patient back on, make sure that the settings are correct, everything looks great. I'm going to reassess my patient, make sure that I hear bilateral breath sounds, chest rise, that the numbers look good. And then I'm going to disconnect my O2 tank. I'm going to depressurize it. I'm going to disconnect my BBM mask. And then I'm going to turn the tank off because we no longer need it. I'm going to take the transport vent, I'm going to turn it off, I'm going to clean it, I'm going to reset it up for the next person to use it. And then I'm going to document and chart everything that I did, put it in the patient's chart, and let the doctor know that we are back from CT. And then I'm going to take off my gloves, wash my hands, exit the patient's room, and chart. The end.